Good morning once again to all of you. Welcome back to today's lecture. What we are doing today is Introduction to Dental Indices, and that is me, Promise Ucheka, your presenter for today. And the aim for today's teaching is to introduce the concept and the use of indices in community dentistry. So what are indices? Why do we use them? What is it all about? So that is what we'll be talking about today. So we'll be introducing the concept of it and then let you understand the uses of it before in the subsequent lesson we will now discuss specific dental indices and how they are practically applied. So today is a general overview of dental indices. The objectives for today's class will be to introduce the concept of dental indices in community dentistry, to introduce and define the characteristics of dental indices, to discuss the classifications of dental indices that we used in community dentistry, and to introduce the different types of dental indices that is available for use in community dentistry. Okay, that is our objectives for today. And by the end of today, as our learning outcomes states, you the student, should be able to define dental indices. You should be able to define and discuss the characteristics of dental indices, and you should be able to discuss the classifications and types of indices used in community dentistry. I will need you to pay attention to this very teaching today because it will form part of the questions that you will be answering next week in your examination. So dental indices, let's look at an introduction to dental indices. So by definition, what are dental indices? So dental or epidemiological indices, okay, are means of classifying clinical conditions in a graduated scale. What that means is that when you have a clinical condition, say periodontal disease, for example, you see 3 people or 5 people that are suffering periodontal disease, and then you look at the severity of the periodontal disease, their complaint is not exactly the same. So one person might be complaining of, having some sweet, salty taste in their mouth, which could be an early sign of a developing periodontal disease. And the other person might be having, rough, very reddish, swollen, inflamed appearance of their periodontium, the gum. And then you look at it, this is periodontal disease, that is periodontal disease. The complaints are a bit different, but how then do you classify them? How do you say this person have more periodontal disease than the other one, or this person have an advanced periodontal disease? So there is clinical condition. So for a clinical condition, there needs to be a means of classifying them, grading them, to know which one is mild, which one is moderate, which one is severe. Okay, so that is very important, and that is what dental indices are used for. And then in this clinical setting, clinical conditions, how do we classify these clinical conditions when we are talking about the community? Okay, how do we know which community has more of a particular disease than the other? How do we quantify that? That is what dental indices are used for. Okay, an index is a set of numerical values ranging from a minimum to a maximum limit. So in most cases, there is a baseline for measurement when you are using an index. Okay, there is a baseline for measurement where you say in an ideal situation, like when you're talking about occlusion, you say there is an ideal occlusion. Ideal occlusion probably does not happen, but it's an ideal, it's the baseline from where deviations can be measured. Okay, so we're using an index, whatever kind of index, to measure any oral diseases. You need a baseline, a minimum limit for a minimum range for the index. Okay, and then you now set a gradient upon which you can reach a maximum limit, except if there will be anything such thing as infinite limit. Okay, so that is what an index is used for. And then, so what that means is you have a lower scale and an upper scale. So you have something, say, from mild, which will be the lower, or maybe say the absence of a condition would be, in some cases, the lower scale of an index, or the lowest scale of an index. And then the most severe form of that disease will be at the upper scale of an index. Okay, and indices are used to describe variations in specific clinical condition based on graduated scale. So that is what I've been talking about now. So you use indices now to describe variations. What we mean by variation is, how does this condition in this person vary from the condition in this person? And also looking at it at a population level, how does this condition in this community vary from this condition in this community? So you need something that is quantifiable, something you can measure, measurable scale. So the diseases need to conform to a scale that can be measured. So that is what indices are used for. So the specific, so indices use specific or same criteria or method to make comparison between the same variable from different populations. Exactly what I've said now. So so when you're using a particular index, so there are different kinds of indices. So we are not trying to compare two indices. We're talking about using one particular index now to measure the same disease in different populations, okay, or in different persons, in two different patients. So you are using one index, one kind of index, to measure diseases at two different times. Now, what that means is that that index will use the same criteria, okay, the same criteria. The index, if it is calibrated from 0.5 millimeter to 6 millimeter or above, there should be the same criteria of measurement that you will use to apply on one patient, and then use the same criteria to apply on the other patient, and then you can compare the variation. So you can do that with a community as well, or a population. You can use the same criteria on one population and apply it on another population. There you can now find the differences or the variation in the populations. So uses of dental indices. This is probably, I've said some of these things already. So the indices are used to make accurate assessment of a particular disease under investigation. So like I said previously, indices are used to make accurate assessment of a particular disease. So when you're talking about a particular disease, so you're talking about either dental caries or oral hygiene or debris in the mouth or periodontal disease. So if you are talking about periodontal disease, you want to make an assessment of periodontal disease. So you need an index that can tell you, that can give you an accurate measure of the amount of periodontal disease or whatever disease in this person. Okay, it is not enough to say this patient that I've seen now has dental caries. This patient that I've seen now have dental anxiety, but there needs to be a scale with which you can measure the amount of whatever condition it is you are you are trying to assess on that patient, which will now make that patient or that community to be comparable to other patients or other communities if you use the same index. Okay, so indices are used to compare the extent and the severity of a disease among individuals and communities. So this is exactly what I've said. You look at the extent of the disease, the severity, mild, moderate, severe. So in one community, is one community having on average mild periodontal disease or mild gingival bleeding or whatever you are measuring. So is it mild in this community and severe in the other community, or is it the same? It could be the same. It could be that there is absence of this disease in this person, and also there is absence of this disease in that person. So it gives you that comparison of the extent and the severity, or the presence or the absence of the severity, because there are simple indices that measure just the presence or the absence of a disease in a patient. They are used to find out the etiological and predisposing factors of the disease. Okay, so when you use an index can be used to find out the etiology and the predisposing factors, the causes of the disease in a community. So when you're looking at a community now, you look at this community and you compare them with another community using an index, whatever index based on the disease you are looking at, and then you'll be able to find the etiology and the predisposing factors. What are the things that are happening in this community that is making them to be prone to having more of this disease than the other disease? So if you look at a comparable community and you find out that this community have less of this condition than the other community, then it will bring you to think about what could be the underlying factors that are making that to be the case. Okay, what are the underlying factors that is making that to happen? So it helps you to do oral health policy planning. So you use indices for oral health, for planning of oral health policies. What this means is that for you to be able to set policies, okay, for the government to be able to set policies, or for you to make policy recommendation, or if after studying community dentistry you get a job with the government, with an NGO where you are working on policies, you need indices to be able to make accurate policies. Because if you don't have an idea of what is going on in this community, if you don't have an idea of what is going on with the patients with regards to their oral health, you cannot be able to actually make policies that will positively impact on them. What could be happening is you might be making policies for something they don't need. Okay, you might be trying to make policies for something that they don't need. You might be making a policy concerning use of fluoride in a community when they already have access to fluoride, or more than access to fluoride. Okay, so but if you use indices first to do an assessment, remember when we talk about community oral health need assessment. Okay, when these indices are used to make these assessments, you can use the results of the assessment to plan oral health policies. Indices are used to assess the prevention and curative efficiency of measures taken to manage diseases. What this means is that you use an index. There are indices that can measure. There are kind of what we call reversible indices. So they can measure cases that can reverse. For example, you have a patient in the clinic and you want to look at gingivitis, okay, or you want to look at debris index in the mouth of the person. You want to look at the accumulation of debris in the mouth of a person, or plaque in the mouth of a person. And then you, first of all, before you give the treatment, you do a baseline measurement. When you do a baseline measurement and then you either give treatment clinically or you recommend self-care practice for the patient. Now, after a period, when that practice or treatment is completed, you can use the same index to measure that factor again to see the variation, to see if the management that you have introduced was effective or not. So it's a kind of pre and post intervention measurement. So indices are very useful in making you understand whether this treatment is working or not. Okay, whether this line of advice you are giving to the patients are working or not. You use indices to get the information that you need to make that decision. So, what are the properties of an index? Now, under ideal situation, okay, under ideal situations, all things being equal, an index must be able to meet up with certain characteristics. Okay, there are things you expect from an ideal index before you can say this index is good for use. First, clarity. An index must be clear enough. So the process of using the index must be clear. Reliability. How reliable is the measurement that you use this index to do? Validity. The results of the index, are they valid? To what extent are they valid? Sensitivity. How sensitive are they to the disease you are using them to measure? Quantifiability. Can you measure something actually with the index? How quantifiable is the measurement that you are doing? And acceptability. How acceptable is the index you are using? So you cannot be using an index that you introduce an index, now you say, oh, I've just generated an index for use, and now it's not acceptable by the professionals, it's not acceptable by the patients, the community do not accept it. That index is not going to work. So it's not an ideal index. So for an index to become ideal and valuable and useful, it needs to be acceptable. But don't worry, we are going to go through these properties one after the other so that you can have a better understanding of what they mean individually. Clarity. How do you know that an index is clear enough for use? How do you measure the clarity of an index? First of all, what is clarity? The rules guiding the use of the particular index that you are trying to apply should be easy to remember without causing confusion. Okay, so you cannot have an index to use, and every time you want to use the index, you need to ask Google, how do you use this index? Because the rules are so complicated, you can't even remember how to apply them. It's like you want to do scaling and polishing on a patient, and if the use of a manual scaler or whatever kind, I don't know which scaler to mention, is so complex that you don't even understand the rules guiding it. But this is what you need to use for the patient. And every single time you want to use this particular instrument, you need to start asking questions about you need someone to read out some rules from a textbook or from internet on how you can use that. That means the rules guiding the use of that particular instrument is not clear. It's not easy to remember. There is a lot of ambiguity around it. So when we're talking about clarity as a property of an index, the rules guiding the use of that index should be straightforward. Okay, it's something that once you've learned it, you can always remember it. You remember it, you apply it, and there you go, without causing confusion, without being confused about it, or without causing confusion by the use. But how then do you measure clarity? How do you know that an index is clear? There are two factors that you use in measuring clarity. One is simplicity, and the other one is objectivity. Okay, simplicity. The use and application of the particular index under that you are trying to use should be easy to avoid wasting time during the examination. Like I said, you don't want a patient on your bed, on your chair in the dental clinic, and then you are reading from a textbook. You are reading from a textbook and you're saying, okay, the textbook says you should hold the instrument with one hand, and then you hold with one hand and you have to use your left hand to open to page 250 on the textbook. Okay, so then that means the index you are trying to use or the instrument is not simple. So it should be simple enough to avoid time wasted. So when the moment you make a decision that you want to use this index on this patient or this community, it should be very simple, very straightforward, no time wastage. Pick the index, do your assessment, and that's it. Objectivity. The index should have clear, explicit, and unambiguous measurement criteria. So just like I've said before, the criteria for measuring, if it is scales, if it's an instrument that is scaled, okay, now you look at the scales should be straightforward, should be something that is not ambiguous, no confusion, straightforward scale. If the scale is measured in every 0.5 millimeter, so you should be able to see that the scale is 0.5 millimeter, say 0 at the baseline, 0.5, 1, 1.5, 2, 2.5. So you don't want to start doing conversions and so much arithmetic in trying to figure out what you are seeing in the patient's mouth. Objectivity. It should be clear, it should be explicit, straightforward, no ambiguity. You use it, the criteria, once you learn it, you understand it, and you can apply it at any time. So that is clarity when we are talking about clarity as an ideal property of an index. Validity. How do you measure validity? In epidemiology, there is something we say validity and reliability. So if you are doing screening, for example, you want to screen for cancer, you want to screen for prostate cancer, you want to screen for breast cancer, you want to screen for diabetes, you want to screen for periodontal disease or whatever, or oral cancer, whatever you want to screen for, then you use a test apparatus to do this screening. However, you need to test that apparatus for validity and reliability. Okay, how valid is the result that you will get with this instrument, with this test kits, with this apparatus? How valid are they, and how reliable are the results? So I'm going to try to explain what validity and reliability means, both in community dentistry and also in epidemiology, so because they work hand in hand. Now, validity here for an index. A valid index should be able to measure what it is intended to measure, okay? And it should be able to correspond with the known clinical stages of a disease. Then you can say the index is valid. What this means is that if you say this index is designed to measure, say, dental caries, the present, the past and present history of dental caries in a patient or in a population, that index should be able to do that. Okay, you cannot say you are trying to measure dental caries and the index is focusing on bleeding gum. The index is focusing on oral cancer. It's talking about something else when what you are intending to use the index to measure is dental caries. So the index must be able to measure what it is intended to measure. And also it should be able to correspond with the clinical stages of a disease. Most diseases have onset, mild, moderate, severe, and probably very severe or most severe forms or cases of that disease. Okay, now if you have an index that measures a disease only at its mild stage and most severe stage, and then the disease have in between stages, so it has a moderate stage or a semi-severe stage, and this index does not pick those stages, then it is not a valid index. So an index must be able to correspond with the clinical stages. What are the clinical stages of periodontal diseases? What are the clinical stages of dental caries? What are the stages of calculus accumulation? Okay, we have subgingival, supragingival calculus. If you are using any calculus index, it should be able to pick different stages of calculus development and progression. If not, it will not be a valid index. And for you to be able to measure the validity of an index and also the validity of an apparatus in epidemiology, you need you use sensitivity and specificity to measure this validity. Okay, use sensitivity and specificity to measure the validity of an index or an epidemiological screening test. I'm going to explain what that means in the next slide. Now, epidemiological screening test evaluation. When you're talking about sensitivity and specificity, in order to validate a test, this is how it works. To assess the validity of a screening tool in establishing the presence of the disease, you compare it with a gold standard. For example, occlusion. For you to be able to get to measure deviations from an ideal occlusion, you need to establish what an ideal occlusion is. That is the gold standard. Gold standard, it may not happen, or it may happen when it comes to like something like occlusion, but you need to set that gold standard from where you can now measure deviations or variations from the ideal situation. That is why you now have normal occlusion and other classes of occlusion that you have, that you're now measuring from the baseline, the gold standard, the ideal. Now, sensitivity. How sensitive is the test apparatus that you are using? How sensitive is the index in measuring the disease you want it to measure? And how specific can that apparatus be in identifying the people that do not have that disease? So sensitivity and specificity here is talking about the apparatus being sensitive to the disease condition, meaning that it can identify the presence of that disease that you are trying to identify. Okay, so regardless of the stage of the disease, the apparatus should be able to identify the lowest stage and the earliest stage of the disease. And then you can say it is sensitive. Okay, so the question you have in mind, the question you ask when you're talking about sensitivity is, are all the diseased individuals correctly identified by this test as having the disease? That is what we call false negative and false positive test. Someone goes for malaria test, you don't have malaria, but the test comes out to say you have malaria. That is a false positive test. Okay, you go for malaria screening, you actually you don't have the, I've said you don't have the malaria. When they say you have the malaria, when you don't, it's false positive. But if you have the malaria and the test says you don't have the malaria, that is a false negative test result. So you use that kind of result to measure the sensitivity and the specificity of the test apparatus, in this case of an index. Okay, so specificity. The question you ask, are all the non-diseased individuals correctly identified by this instrument as not having the disease? Or are you including every person that have the disease plus every person that look like they have the disease into the list of the people that have the disease? So if that is the case, you say that this test is very sensitive. It is highly sensitive. Okay, have you seen somebody go for HIV screening and they tell the person they have HIV when they don't have HIV? That means that the apparatus they are using is very sensitive to HIV. Sorry, it is very specific. It is very specific. It is highly sensitive and also very specific, because it is highly sensitive because every person that have the disease are giving positive result, but also the people that look like they have the disease but don't actually have the disease also receive positive results, but they don't have the disease. So you say it is a highly sensitive apparatus and also very specific apparatus. Now, reliability of an index. How can you check that this index you are using to measure whatever disease is reliable? How can you rely on the results of this index? So, in terms of reliability, there should be consistency in measurement. This means that if you use the same apparatus more than once on the same patient, you should be able to get the same result. Do you understand that? So you use the same apparatus on the same patient multiple times. Regardless of the number of times you use that apparatus, you should be able to get the same result. Then you can say this is reliable. Now, if you move that patient to a different examiner, and then the examiner uses the same apparatus to do a test on the same patient, regardless of who did the test or what time of the day they did the test, the examiner should be able to get the same result. Then you can say that this instrument is reliable. So the result of the index should be consistent when used multiple times by the same examiner or even different examiners. Now, when it comes to the reliability of the examiners itself, okay, so it's important I introduce this concept to you. There is what we call inter-examiner and intra-examiner reliability, because you cannot say that an index is reliable without also making sure that the examiners are reliable themselves. So they have to complement each other. How can you give an index which is proven to be reliable, or that you are trying to prove its reliability, to an examiner that you don't know how reliable they are? When you're talking about the reliability of the examiners, you are now looking at their knowledge, their skills in the use of that particular index. Okay, how knowledgeable are they in the use of this index? How skillful are they in the use of this index? So if you standardize that, then you can be able to accurately measure the reliability of an index. Now, how do you carry out inter-examiner or inter-rater and intra-rater reliability? And what is it used for? So inter-rater and intra-rater reliability is used to define the stability or repeatability of the scores recorded by an examiner during oral examination. Now, how do you do this? Okay, sorry, I've mistakenly put this thing 2 times there. Sorry about that. So how do you, in practice, carry out inter-rater and intra-rater reliability? Now, this is what you do in community dentistry. So you go, say you are going for an outreach, you want to do an assessment of, say, a school, for instance, and you go with 2 oral examiners and you give them the same instrument to do oral examination. And then while you are doing the oral examination, you now see that you now get a particular patient, okay, without the knowledge of the examiner. So if you are the one sending in the patient to the examiner, so you sit there, you are controlling the patient, the examiners are in the examination room, and you send in the patient to them, and they do the assessment, record their result, and release the result to you. And now, after multiple times, you send in a patient that you've sent in before to that same examiner. Okay, So if you send in the patient again, and the examiner, without knowing, goes through the examination process with this patient again, the result of that examination is supposed to be the same. Now, the examiner have examined this patient more than once, the result should be the same. That is intra-examiner reliability or intra-rater reliability. Now, in the case of inter-rater reliability, what you do is that when you have two examiners examining simultaneously, after they've examined a number of patients, you switch patients that they have examined in the past. You switch the patients that they have examined in the past, send this one to this person and send the other one to that person. If they come out with the same result again, then you can establish that they are reliable. So you now have your inter-rater or intra-examiner, inter-rater and intra-rater reliability have been confirmed. Sensitivity of an index now. So how do you know that an index is sensitive? The index should be able to dictate the smallest changes in the disease condition that you are trying to investigate, which means that in a reversible disease condition, the index should be able to pick the smallest changes. Okay, the index should be able to pick the smallest changes in the disease condition. So if a disease condition is progressing, you have checked the patient before, it was mild, now it is moderate and severe. If you use the same index, the index should be able to pick all the different stages of that condition. Okay, now that is in the case of a disease progression. Now, in the case of disease reversal, so you've checked the disease condition, you use the index on the disease condition, and then you give treatment for that disease, and the disease reverses to the normal stage, to the healthy stage. Okay, now that same index should be able to pick that reversal to say that, okay, this patient had an index of 0.5 before, now it is 0, or an index of 1.5 before, now it is 0.5, meaning that there is a reversal in the disease condition. So a sensitive index should be able to pick that changes in direction of the disease. Quantifiability. So how do you say that an index is quantifiable? So an index should be one that is open to statistical analysis. Now, if you are doing an index, remember we are looking at numbers. Okay, for you to be able to quantify the disease that you are looking at, you are talking about numbers. Okay, now in this numerical sense, what you do is that the index you are using should be able to classify or assign numbers to the disease you are measuring. The index should be able to say this is 0.5, this is 1.5, this is 5 millimeter, this is, no matter the calibration you are using, it should be able to assign numbers to them. Now, when numbers are assigned, the reason for that is that you can then be able to compare the quantity, quantify the disease, the quantity of this disease in this person can be compared to this other person, or from this community can be compared to another community. But if you cannot quantify the presence of the disease statistically, you cannot be able to compare them with other communities or other individuals. And if that is not done, then you will not be able to actually assess the effectiveness of the intervention you are applying. You cannot be able to assess, make comparison. You cannot be able to generate policies. Okay, so you need an index that is quantifiable. So the disease status of an individual or a community or that of a population under investigation should relatively be able to agree with a numerical expression on a graduated scale. So you can be able to say that this community have more dental caries than that community. And you can only do that statistically. Okay, and when we're talking about statistics, you're talking about numbers. Okay, you can be able to do that, to say, okay, this is the amount of this disease in this community, which differs from the amount in this community, which is probably the same with the amount in that community. An index that you're using should be able, an ideal index should be able to quantify diseases numerically. Now, acceptability as a property of an index. So when you are using any dental indices in community dentistry, it needs to be acceptable. I've said this before. An index that you apply on a person or a group must be acceptable. It must be accepted by the people that are using it. So the professionals must be able to accept it in order for it to be in use, and the patients must be able to accept it. So it is supposed to be painless. So a screening procedure, a screening apparatus that is painful will not be acceptable by the population. It may not even be acceptable by the professionals, carrying out the examination. So it needs to be painless, and then it needs to be something that does not reduce the dignity of the person that is being examined. Okay, you must make sure that it does not reduce the dignity, to demean the person that is being examined. You cannot ask people to subject themselves to things that will not dignify them, regardless of what kind of disease you are trying to find that they have it, whether they have it or not. It must be able, the process must be able to at least maintain the dignity of the patient that is being examined. If that is not the case, if the instrument is demeaning, if the instrument is painful, if the instrument is not widely accepted by the professionals, then it will fail the test of acceptability, and then you cannot have usable index. So what then are the types of indices we use in community dentistry? So you have what we call the simple index and the cumulative index. Okay, you have the simplified index, you have the full mouth index, you have reversible and irreversible indices, and you have the composite indices. So these are the different types of indices that we use in community dentistry. So we'll go through them one by one for you to get a glimpse of what they are. So there are different types of indices that can be used in community dentistry. Like we've said, simple index. So a simple index is an index that straightforwardly measures either the presence or the absence of a disease without paying attention to the severity, without trying to classify them. So you want to find out, does this patient have this condition, yes or no? There are kind of yes or no indices. You apply them. For example, plaque index. Is there presence of plaque in the patient's mouth? Yes or no? That's it. Simple index. You just use it to dictate whether there is plaque or not, whether there is periodontal disease or not, whether there is dental caries. So any index that can only or straightforwardly identify the presence or the absence of a disease condition without measuring the impact it has on a patient is a simple index. Cumulative index. So cumulative indices are indices that can measure the history of a disease condition. So they are looking at the past and the present evidence of a disease condition. And in that case, we're talking about something like dental caries. So dental caries, because dental caries now, somebody can develop dental caries now, you can arrest the caries. So if you have a case of arrested caries, the caries will no longer be able to progress. But then you can still be able to measure the history of the caries. So there had been a presence of the caries in the past. Caries have come in the past. The dental caries situation can also be treated. You can do some restoration on the tooth. Even after you've done the restoration, that still keeps an evidence. It still gives evidence that dental caries had occurred in that patient. Okay, even if it gets to a worst case scenario where the tooth is lost, that is still an evidence that dental caries had happened. So any index that can be able to measure the past and the present evidence of a disease is a cumulative index. And one example of that is the decayed, missing, and filled teeth index, the DMFT index. So you use that to measure whether the teeth have been decayed in the past. Does the patient have any fillings in the mouth, or have the patient lost any tooth already? So you can use that to measure the activity of dental caries in the mouth of a patient. With that kind of index, you say this is a cumulative index. Reversible and irreversible indices. Now, an index that can measure the condition of a disease after the disease had been treated, okay, is a reversible index. So it's used to measure conditions that can be reversed. For example, when you're talking about gingivitis now, you know that the gingivitis is the earliest and reversible form of periodontal disease. So you see a patient with early stages of gingivitis, you give the patient the accurate treatment, and the situation is resolved, and this condition is reversed. So the condition is able to return back to the original state of health. The gum returns back to the original state of health. So any indices that can be used to dictate that disease condition when they have been reversed. So you say it was there, it's no longer there. So you used it before the intervention, and after the intervention, you measure it, and then you cannot get that measurement again. So you can say it's a reversible index. Okay, so an indices that can be used to see the changes pre and post intervention changes. So you do give gingival treatment, you do your so let's say you have a patient that is developing marginal gingivitis, you treat the marginal gingivitis, and the gingival margins returns back to normal, and then you come back again to do a follow-up assessment, and then you don't find the marginal gingivitis again. So that kind of index that you can use to dictate the presence of the disease and also dictate that the disease had been treated is a reversible index. But irreversible indices are the indices that only measure the presence of a disease in one direction. Okay, they measure in one direction. So this is used to measure diseases that cannot be reversed or returned to the previous state of health. For example, if dental caries happens in the mouth of a patient, dental caries cannot be reversed. No matter what you do, you can arrest it, you can stop it from progressing, you can treat it, you can do filling, you can fill the tooth, you can extract the tooth if you choose to do so, if you cannot salvage the tooth. The moment the dental caries happens, that cannot be reversed. So any indices used in measuring dental caries has to be an index that measures in one direction. So because that you are looking at an irreversible situation. So indices that can measure only in one direction, the scores of such indices cannot reduce. So unlike gingivitis, when we talk about marginal gingivitis, so you can get a score with a gingival index. Now you get a score of, and you can say that, okay, there is the presence, you have established the presence of marginal gingivitis in the mouth of this patient. And after treatment, you measure again and you don't get the score, or you get a score that is less than what you got before. That means there is reversal. The state of health is returned. The gingiva are returned to a previous state of health. So that kind of index is reversible. Index used to measure reversible diseases, but in the case of dental caries, once it happens, it only progresses, but it doesn't go back. You can arrest it if you want, you can feel it, you can do whatever kind of treatment, but you cannot return that tooth to a state of health where it says that the dental caries did not happen. We are not there yet. We might get there in the future. So indices like the decayed, missing, filled teeth index can be termed an irreversible index. So composite indices. So these are indices that are used to measure both conditions that can be reversed and those that cannot be reversed. So example of conditions that can return to normal state of health. So we're talking about the gingival index. So the gingivitis can be cured and return to the normal state of health. And then you have another example of periodontitis, which is the irreversible form of periodontal disease. So any index that you can use to measure gingivitis, which you can measure it today and detect the presence of gingivitis, and you measure it tomorrow in the same patient after you've given treatment, and you measure that it's been reversed, there is now the absence of gingivitis, and you use the same instrument, the same index to measure in a case where no treatment was given, no precautions were taken, and the disease progressed to an irreversible stage of periodontitis, where you now have loss of alveolar bone destruction and all that. And the same index can also measure that stage of the disease where that it cannot no longer be reversed. So that is a kind of a composite index. So in this case, you have the community periodontal index of treatment needs, which is calibrated from 0.5 to up to 6 millimeter and above. So 0.5 to 1.0, those are the scores that you would normally get in the case of reversible stage of periodontal disease. And when it progresses to developing deep periodontal pockets and more advanced periodontal pockets, then you know you are talking about periodontitis, which cannot be reversed. So in this kind of a case, that is the type of index you can refer to as composite index. Simplified index measures only representative sample of dental apparatus. Okay, so examples of that would be the oral hygiene index. So you have the simplified oral hygiene index, simplified debris index, and simplified calculus index. When we talk about indices in part 2, we'll be able to look at how to use these indices in practice and what their differences are. So you can also have a full mouth index. So any index that can be used to measure the entire mouth of the patient is a full mouth index. So you have the CPI, you have the Dean fluorosis or periodontal, the Rosel's periodontal index. I've put links to these references where you can actually go and read up on these indices and how they can be applied. So these are examples of full mouth index, indices that can be used to measure the full mouth of a patient instead of maybe a particular tooth. So now, before we close, indices are also can be classified also based on the kind of disease they measure, the symptoms that they dictate, and the treatment. Okay, so we have the disease index, the symptom index, and the treatment index. So the diseases they measure, you can use that to classify index. So that is why you have periodontal index, calculus index, because I am not talking about specific things. So that is another kind of classification. We'll talk about this kind of classification when we are now doing the part 2 of this dental indices. So now you're talking about the gingival index, the oral hygiene index. You are now classifying that indices based on what you are using them to measure. So you look, if you're talking about dental plaque index, so you are classifying that particular index based on you using them to measure dental plaque. Okay, so that is another way of classifying dental indices based on the entity that they measure. And here I've put up a few references to some of the things we've talked about. So if you click on these links, they can take you to articles where you can read and study more about dental indices. And at this point, we'll bring this recording to a close. for today. Thank you for listening. Thank you for being here. And we shall now continue with the questions offline.